Hey everyone, welcome back to Corporate Decoder, the place where we decode the corporate world and uncover the hidden narratives within their filings. And let me tell you, Arvinas Incorporated has some pretty interesting preclinical data to share that might just change the game for a really tough cancer. So buckle up, because we're diving into Arvinas Incorporated's latest report where they're dropping some serious news about a new weapon in the fight against cancer. And hey, before we get too deep, if you like getting these clear, no nonsense breakdowns of corporate filings, make sure you hit that subscribe button. We also have a fantastic community over on Discord with the link in the description below, so come join the conversation. Alright, on the 24th of October of 2025, Arvinas Incorporated put out a press release about some very promising preclinical data. Now, preclinical means it is before human trials, think lab studies and animal models, but the results here for something called ARV-806 are looking seriously good. Let's break down what that mouthful means. ARV-806 is a PROTAC, which is a fancy way of saying it is a molecule that helps your body's own waste disposal system get rid of specific target proteins. In this case, it is targeting KRAS G12D. Now, KRAS G12D is a very common mutation found in several aggressive cancers, like pancreatic, colorectal, and non-small cell lung cancer. Think of it as a faulty switch that is constantly stuck in the on position, telling cancer cells to grow and divide uncontrollably. These exciting findings were shared at a major scientific conference, the 2025 Triple Meeting, which shows they are getting attention from the experts. What's really neat about ARV-806 is its ability to target both the active and inactive versions of this faulty KRAS protein. This is a big deal because it means it could potentially shut down the cancer growth signal more effectively. So in lab tests, Arkansas V-806 was incredibly potent at breaking down the KRAS G12D protein in cancer cells from pancreatic, colorectal, and lung cancers. Even better, it specifically targeted the bad KRAS G12D and left the healthy versions and other related proteins alone. This is key for minimizing side effects. Think of it like using a very precise tool that only removes the broken part and doesn't touch the perfectly good ones. Arvinas believes ARV-806 could be a real game, changingly the best treatment available for these types of cancers. Why are they so confident? One reason is its catalytic activity. This means it can keep working and break down the bad protein even if the cancer tries to produce more of it, which is a common way cancers fight back against other drugs. And here is where it gets really interesting. When compared to other treatments already in human trials, Arkansas V-806 seriously showed its worth. It was over 25 times better at stopping cancer cells from growing. That is a huge jump in effectiveness. It was over 40 times more powerful at actually destroying the KRAS G12D protein compared to another drug designed to do the same thing. This is a massive difference, and it needed over 10 times less of the drug to trigger a natural cell death process in cancer cells. So, it is more effective at lower doses, which usually means fewer side effects and a better patient experience. In animal studies, a single dose of ARV-806 had a really long-lasting effect. It wiped out over 90% of the bad KRAS G12D protein for a full week. Not only that, but it also shut down a protein that fuels cancer growth called c-MYC and boosted a protein that tells cancer cells to die called BIM for at least 5 days. This sustained effect is what they're banking on for less frequent dosing in patients. And when it came to shrinking tumors, Arkansas V-806 showed solid results even at low doses. They saw at least a 30% reduction in tumor size in models of pancreatic and colorectal cancer, and also in a lung cancer model taken directly from a patient. This is exactly what you want to see in early development. Based on these exciting preclinical results, Arvinas is now testing ARV-806 in people. They've already started a phase 1 clinical trial for patients with advanced solid tumors that have that specific KRAS G12D mutation. This is the crucial next step, and everyone will be watching closely. The presentation also hinted at even more good news. They've identified other drug candidates that can be taken by mouth, meaning pills instead of injections, and can target a whole range of KRAS mutations, still being careful to leave the good ones alone. And they even showed that one of these pan-KRAS drugs worked really well on its own, and even better when combined with another type of cancer therapy called immune checkpoint blockade. In their studies, this combination led to 7 complete responses compared to only 2 complete responses with a different type of treatment. Now, it is important to remember that all these fantastic results are from preclinical studies and early to mid-stage trials. The company is clearly optimistic, and these data are highly encouraging, but the real test will be in larger human trials where safety and efficacy across a broader patient population are evaluated. Looking at this from a broader perspective, Arvinas Incorporated is making some serious moves in the targeted cancer therapy space. Their PROTAC technology is proving to be incredibly powerful, especially when it comes to tackling difficult mutations like KRAS G12D. The precision of RV-806, its potency, and its sustained activity are all major strengths. However, the biggest opportunity here is filling a massive unmet need in several aggressive cancers. The company's potential to develop a best-in-class therapy is exciting, offering hope where options have been limited. The main risk, as always with drug development, is the transition from lab and early human trials to broader clinical application. There can be unexpected safety issues or efficacy challenges that arise in larger patient groups. Also, the competitive landscape for cancer drugs is always evolving, so staying ahead of new developments will be critical. Overall, Arvinas Incorporated is demonstrating significant scientific innovation and moving promising drug candidates forward. RV-806 appears to be a strong contender, and its progress will be closely watched by patients, doctors, and investors alike. It's a story of cutting edge science tackling a notorious cancer mutation head on. Alright, that is our breakdown of Arvinas Incorporated's latest report and the incredible potential of RV-806. What is your take on these preclinical results and what they signal for the future of cancer treatment? Drop your thoughts in the comments below. If you found this deep dive valuable, hitting that like button really helps us out, and if you want more of these straightforward corporate analyses, make sure you subscribe. Don't forget to check out our Discord community linked in the description for more discussions. Thanks for watching, and we'll see you next time on Corporate Decoder.